Hello everybody, my name is Sean Bellis and welcome to That Massage Guy. Today I'd like to talk to you about carpal tunnel disorder. Alright, so what is carpal tunnel disorder? Well, generally it's when people complain that they have numbness, tingling, sensations, even sometimes pain into their hand. Alright, and what could that be from? That could be from just the normal mousing at work, and generally that's about 70 to 80% of the people that usually complain about carpal tunnel is people that have a desk job or when they're doing a lot of compression at the wrists. All right. So what is the carpal tunnel? Well, your carpal tunnel is 8 little carpal bones that are right in here, and what happens is you have your nerves all kind of coming up into your hand right from that little tunnel. All right. So if that tunnel gets a little compressed, either right at the wrist or right at the forearm flexors before it, you can get that numbness and tingling into the hand. But that's not all. I mean, that's not the only areas in your body that can cause those same sensations of like that carpal tunnel sensation. So there's other areas that can be compressed. There's nerve bundles in your neck called the brachial plexus nerves that can also be compressed here in the neck and also compressed right here at the pecs. All right. So if it's compressed, by either overuse or, a lot of that muscle contraction at the neck, at the pecs. Just think of the nerves coming down right through here, and it goes right and down into the hand. So sometimes any compression along that line can cause that tingling and numbness into the hand. All right, so what generally happens is because people don't generally understand that is the reason why they feel that numbness and tingling in the hand. They just know that it's overuse from mousing, too much compression at the wrist due to their job mainly. All right, so what happens is people will get that, and usually it starts off not too bad. It gets a little numbing and tingling, and you just do a little bit of this, hoping that it gets better. But it generally gets, if it doesn't get better, it starts to get worse and worse and worse. And then what happens is when it gets really bad enough where your quality of life is affected, people will go to their doctor and they'll say, "Hey doctor, what can I do about this? I can barely feel my fingers. It's hard to move my fingers. What I need to do?" Now, it depends on what your primary care physician will say. Sometimes, they'll send you to PT, which I would highly recommend. That's always a good avenue of approach. Of course, as a massage therapist, I will always say, find a massage therapist that deals with pain relief techniques such as myself, or anybody in your area that does specific work for pain relief, right? Anybody that does any mobility will help, all right? But sometimes a doctor will also give, maybe muscle relaxers to see if that does anything. Maybe they will refer to orthopedists, that kind of stuff. And if it's really bad enough, some people let it get so bad that there's total nerve compression at the wrist. Or even up here at the pecs where those nerves kind of come through this way. All right, so when you get that total nerve compression, a lot of times they'll recommend surgery. And if it gets to that point, a lot of times that's probably going to be the route to go. If it has a total compression, meaning you could barely move your fingers, it feels like such a pressure at the hand, it's very unbearable. But usually it takes a very long time to get to that point. All right, and it can be reversed. If you already have carpal tunnel, if you have the symptoms of carpal tunnel, it can be reversed. All right, it's one of the most easily preventable surgeries out there. All right, so I mean, I can't even tell you how many clients will come to me and they'll say, "Hey, Sean, I've had like 4 carpal tunnel surgeries, and my hands, I just don't have the same feeling in my hands anymore." And I mean, each surgery, you got to think. Little nerve fibers, the little nerve bundles, they're smaller than strands of hair. There's no guarantee that a surgeon isn't going to accidentally cut 1 or 2 different, nerves that cause, sensations into the hands, right? So it is very easy to, not do this surgery. And that's basically, I guess, the point of making this video is if you're already scheduled for a surgery concerning carpal tunnel, or you're even thinking about it, I would say get a second opinion, go to a PT, go to a massage therapist that deals with pain relief. Today I'll give you a couple of different exercises you can do on your own, all right? And it's funny, some people will actually get the surgery down here, right? And then they'll wake up and they still have that numbness and tingling in the fingers. How's that even possible? Because maybe they missed what the true symptoms were up here from the neck compression and then to the pec compression, right? So you want to be, you definitely, I would say you want to make sure that you try to take care of yourself first before any surgery interactions, all right? So what I generally do when my clients come in to see me is I generally do an assessment. I see, okay, well, we'll see what's going on here, maybe at the neck. We'll work into the chest, into the pec, to see if any of that tingling sensation goes down into the hand, all right? So, and if it does, and if I do find that same sensation you would feel down into the hand, or, I would basically say, oh, we found it. It's in the neck. It's not down here. It's in the neck, and it's from the pecs. How can that be? Just compression. It could be that you're looking down quite a bit. Maybe you're on a job and you have your head like this with the phone right there. Who knows? It's just it can be just any repetitive movement that cause compression at the neck. It could be the way you sleep. It could be a lot of different factors of why you feel that way. So basically, what I would suggest to do, and here's a couple things you can do if you're starting to feel that, maybe take some fingers and rub around to the neck. You may or may not get a tingling sensation to the hand. I would also stretch the pec. Now, a good way of doing that is basically having your arm up at an angle like this to the side of your body. Place your hand like up against the wall. Turn your torso away so it opens all of this pec up. All right, and if you turn your torso away and it opens all of your chest right here, you may even feel a little bit of that numbness and tingling into the hand already. And you may not even get that sensation, so that's when you go down. One good way, if there's to kind of figure out if it's in the forearm itself, is you put a little bit of lotion on your forearm, take your knuckles, and then kind of just go this way, or hey, you can go right to the wrist this way, all right? And actually, a better way to do that is place the forearm on the table and use the leverage of the table to kind of dig your knuckles right in and then go towards the wrist. Or even away. Sometimes, either way, it's what it's going to do is it's going to stretch out those muscle fibers. And if there's any compression in there, you'll definitely feel it go up into the hand. And of course, you've probably seen people do this and this. But I would do a good rigorous with your knuckles. Dig right in. You could even use little, it'll probably leave little red marks behind. And then afterwards, do a nice stretch that way. And this way, because you want to make sure that the forearm flexors here are going to be stretched out, all right? Because that'll also help out a little bit if there's nerve compression here. Now, those are just little self-care things that you could do. There's tons of things you can Google and find online. But my recommendation is if you're having a lot of carpal tunnel type symptoms, stay away from surgery. That's the last option always. Try to find a good massage therapist or a PT that could deal well with this. And I would say in my practice, I've probably helped about 7 or 8 people that were already scheduled for carpal tunnel surgeries, and they were able to cancel their surgeries and they were fine afterwards. Okay, and it's funny, a lot of these symptoms, a lot of these things that happen in the body that are chronic can be solved through body work and through PT and that kind of thing. Retraining the brain, retraining your way of doing things so it doesn't get that bad again. All right. So hopefully it was a little bit informative for those that do suffer from carpal tunnel. And if you have any questions or comments, just leave them below. And I hope everybody has a great day. Thank you very much for watching. And I hope to be putting out more of these videos pretty soon. Thank you.